of our teleeducation series. And today's topic is very interesting. We're talking about meat hygiene and the associated zoonotic diseases. This is an industry in Nigeria that needs a lot of attention, but unfortunately, it hasn't gotten enough attention from stakeholders as it should. So we're having today with us revered personalities in the industry, people who have made strides in an attempt to make sure this industry gains the recognition and the recognition it deserves. We have Dr. Professor Junaidu Kabir, who is a public health specialist. And okay, I'll have my slides up first so I can properly introduce these people. Dr. Femi, please can you put the slides up and we can quickly go through the agenda and start. So we're going to be time conscious today. We have 90 minutes to go through, but who knows? This is a very interesting topic, so we could equally just go beyond a little. Okay, so I'll need my screen. Dr. Femi, can you share the screen, please? Thank you. Our hub experts, welcome, welcome. Professor Junaidu Kabir, I can see you. I can see Dr. A.B.Bisola Olusanya. We all saw the flyer. She is the Honourable Commissioner for Agriculture, Lagos State, and she has been doing remarkably well in her work, in her job. So it's really an honor to have you with us here today, ma'am. Dr. Ade is still yet to join Jolaosho. He's also one of our hub experts, and I'll be introducing them duly once I have my screen up.
I am here. Dr. Ade Jolaosho is here, please.
Okay, Dr. Ade, welcome, welcome, welcome. It's good to have you with us. So, yes. Okay, so we can just work with time. I will just start before we have our screen up. So the topic for today's teleeducation series is meat hygiene, the state of our abattoirs and the associated zoonotic hazards. So I will take us through the agenda first, and then we can start. So it's going to be a 90-minute session. And would have an introduction, a brief about Farmalert, a brief about Project TECLA, which is teleeducation for clinicians and leaders in Africa, and a pre-quiz, didactic presentation on the main topic, meat hygiene, examining our abattoirs and the associated zoonotic hazards by Professor Junaidu Kabir, then a case presentation by Dr. Ade Jolaosho, and then a Lagos State as a case study by the Honourable Commissioner herself, Hon.Bisola Olusanya, for 15 minutes. Thank you so much, Ma. And then an open discussion, which is going to be the main, should I say, the main part of the agenda today, because as I've said earlier in our sessions, the ECO model is big on discussion. So we're going to spend about 30 minutes answering questions, taking discussion and observations. And then we're also going to take experts' recommendation for this particular topic, so we can all go home with new information to share with our circle. And then we'll have a post quiz and then a summarization, announcement, and next steps. So quickly, we'll just go through the introduction for 5 minutes. Please, can you, okay, so basically the ECO model is supported by 4 pillars. So these are the 4 pillars: using video conference technology to leverage scarce healthcare resources, specialists sharing best practices with colleagues, case-based learning, and continuous monitoring of program outcomes. Next slide, please. So Project TECLA Africa leverages the ECHO model. We collect registration, participation, answers, chat, quizzes, and poll responses for our program. Your individual information will be kept confidential and handled by authorized personnel. This data may be used for reports, maps, communication, surveys, quality assurance, evaluation, research, and to inform new initiatives. This session is being recorded, and we will be sharing a PDF version of the slides after the session via the email you registered. Next slide, please. So these are tips to help you through the session. Please have your camera on. The facilitator will unmute you when you need to speak. And then please use the raise hand feature in the Zoom. When you want to speak, kindly use the chat function for any questions and comments. Next slide, please. So we are Farmalert, and we're enabling easier access to affordable animal health care. So the next is a brief about Farmalert by Dr. Femi, who is the CEO, Farmalert Limited. Sir?
All right, thank you so much, Dr. Tunisia. It's very good to have you. And then, of course, I want to officially welcome every one of us on board. It's going to be an engaging 90 minutes. All right, so I'll just stay on course. Farmalert, one of the key things we notice is that the animal health component is a big part of the One Health medicine that we all talk about. And then, of course, one of the most neglected part of animal health, it's also the well-being of our animals. And as we all know, there are almost 10,000 veterinarians saddled with the responsibility of catering for over 13 million livestock that we have, in hundreds of millions actually, in Nigeria. And one of the key things we want to do in Farmalert, or we're aiming to achieve, is to ensure that these professionals, largely everybody who will be attending to these meetings, are veterinarians, are equipped with the right thoughts, with the right equipment, with the right knowledge to ensure that we're able to, first of all, safeguard public health, but more importantly, to care effectively for the livestock that we are trained to care for. So on this note, I'm sure I'll still be coming back to introduce the special guests we have, but on this note, I want to welcome every one of us to another interesting and engaging time with us today. Also, the next thing I also want to, we have partners. And M.D.O.C. is one of our partners. So Project TECLA, it's tele-education for clinicians and leaders in Africa. And M.D.O.C. is one of our big partners. And we're doing this across Africa to ensure that people have the cutting-edge knowledge they need to move forward in this present time. So thank you so much. And then I hope that we all enjoy our time with the tele-education series. Thank you and have a wonderful afternoon.
Yes, so I'll be going forward by introducing our, okay, so we're going to have a pre-quiz, which basically is just some few questions, usually 5 to 10 questions, where you answer questions about the topic of discussion for today. It's just basically to help us measure knowledge gained before and after the presentation. So can we have the pre-quiz up, please? Just some few questions, and then we're also going to take a post-quiz afterwards. Okay, can we have the quiz up, please? Welcome, everyone. We can see we have about 77 people in the room. Thank you for sparing out time. Keep introducing yourself, and we have somebody extracting information from the chat box. Okay, I think we're having issues with the pre-quiz, so we'll just quickly take an introduction of our hub experts. So I'm going to start with the Honourable Commissioner Bisola Olusanya, who is the Honourable Commissioner of Agriculture, Lagos State, Ministry of Agriculture. Under her leadership as the Commissioner of Agriculture, the Lagos State government in 2019 engaged stakeholders on the red meat value chain in an effort to revamp the subsector with the aim to sanitize the entire value chain from production to consumption with good economic value for everyone involved, making sure the people of Lagos State consume wholesome meat and are able to export beef in line with world best practices, in return to boost the international recognition of beef from Lagos State. Lagos State people, I must say, are very lucky. And the next person we have as our hub expert today is Professor Junaidu Kabir, who is the Dean of the Faculty of Veterinary Medicine, Ahmadu Bello University, Zaria. He's a professor of public health and preventive medicine. And we have Dr. A.B.U. Jolaosho, who is an appointed official veterinary surgeon by the British government agency, Food Standard Agency from 2000 valid to 2017, with the sole charge of enforcing public health and slaughterhouse legislations in various red and white meat abattoirs in the British Isles, including Scotland and Wales. Appointed local veterinary inspector by the British government agency, Department of Environment, Food and Rural Affairs, 2001 to 2017, with the role of inspecting and certifying live and slaughtered animal import and export to and fro from the United Kingdom. Next slide, please. So yes, so we're going to have a didactic presentation by Professor Junaidu Kabir on meat hygiene, the state of abattoirs and the associated zoonotic hazards. So sir, you have exactly 15 minutes for your presentation. Professor Junaidu Kabir, thank you.
Thank you, I'm here.
Yes, good afternoon, sir.
Good afternoon, everybody.
So you can just share your screen, Prof.
Okay. I don't know whether you can see my screen now.
Yes, we can. I can. Yes.
Can you?
Yes.
Femi, I can't hear you. Can you see my screen?
We can see your screen and then we can hear you, Prof.
You can go ahead, sir.
Okay. Can you hear me clearly?
Yes, we can hear you and we can see the screen.
Okay. Thank you very much. Good afternoon, everyone. Thank you for inviting me to this very important discussion. It is an area that we have been talking about for a long time. And before we proceed, I have to acknowledge that in this country, there have been people that have trained tons and tons of veterinarians on meat hygiene, food safety in general, and have had cause to keep emphasizing the poor state of our abattoirs. So pardon me, I recoined the topic of my presentation to abattoirs in Nigeria and public health implications, because there are some emerging issues that are not necessarily zoonosis, but they are extremely important public health issues. Again, I will just take an overview, hoping that this presentation will provide some talking points for all the experts around to have a fruitful discussion, and for us also to ponder about some of the solutions that we need to.
Population density. And then when you talk about the needs, dietary needs, particularly of protein, of the Lagosian, of the average Lagosian, high. Globally, I think the estimate is about 42 or 43 kilos per person. Lagos is quite high compared to the rest of Nigeria. So if we are on the basis of research, seeing that the whole of Nigeria consumes roughly about 4 million heads of cattle on a yearly basis, Lagos State alone, the people within Lagos State alone consume 50% of that. Almost 2 million heads of cattle is what is consumed on an annual basis, meaning over 6,000 heads of cattle slaughtered from within our state-owned and state collaborative abattoirs, excluding those abattoirs within military perimeters. And by the time you even put that into more considerable estimation, we should be touching over 10,000 heads of cattle every day that is being slaughtered in Lagos. And this is aside sheep and goat. So you can imagine the state of slaughtering that happens every day here. And you're talking about Mondays to Saturdays, on some occasions, even Sundays. And then you can imagine the wonderful and massive opportunities there are within the red meat value chain, within the space. I recollect that Dr. Junaidu had said that one of the state-of-the-art abattoirs in Kano was built, I think around about 1982. The central abattoir that we have here in Lagos, which was facilitated by the late governor, Mr. Lateef Jakonde, and was eventually completed in our Okooba Agege area, was actually launched or established in 1992 as well. So you can imagine that the biggest abattoir, the biggest animal market we have in Lagos, established as far back as 1992, you're talking about almost 29 years ago. And that is still the biggest that we have till date. And yet Lagos has dramatically changed, Nigeria has dramatically changed, the use of technology and what have you. Our abattoirs have not caught up with the technologies of today, neither has it caught up with the times. So in a way, there's a mismatch between what our people are demanding in terms of consumption and in terms of sanitary and hygienic conditions and what was obtainable and put in place back then. In terms of the challenges, obviously, like I said, Lagos being overly populous and not having that much space barely has any input around production, particularly of red meat or of cattle. So the focus here would mostly be around livestock, poultry, piggery, and aquaculture, fisheries. So in terms of cattle, in terms of sheep, in terms of goats, majority of what is consumed in Lagos is brought from outside of the state or from outside of the country. And for that reason, there's a lot of movement of animals in and out of Lagos, obviously by trucks. So we have challenges when it comes to production. We have challenges when it comes to the slaughtering as well, because in terms of proliferation of illegal slaughter slabs, based on the fact that the one major slaughter slab or one major abattoir that was put in place was as far back as 1992. And the way Lagos has morphed and grown, it's obviously grown beyond what existed at that time. And then we also have issues, obviously, around the processing. So what I mean by processing for the red meat, obviously the cleaning, the transportation, moving it up and down, and then onwards to distribution. There are challenges along the way that as a Lagos state government, we are obviously trying to solve. But the truth of the matter is, and what we have seen is everything around the red meat value chain, and particularly anything related to agriculture, the government can only facilitate, the government can only catalyze, the government can only regulate, the government can only enforce. The private sector is supposed to drive this entire sector, and that is the only way you can see sustainability within it, which is the agenda we are now trying to push under our themes agenda of the current governor, Mr. Babajide Olusola. If I talk about the current state of our abattoirs, so from the abattoir itself, I don't think that should even be where the main focus should start from in terms of this conversation, particularly around animal health and zoonotic diseases. We should start from traceability, from origin, from the point of origin. Since we say Lagos is not even a production state, it means majority of what we consume is coming from elsewhere. So if we're even talking about zoonotic diseases, what are the processes being put in place to ensure that the animals that are coming into the state are in good condition. They are healthy animals and not animals having tuberculosis or some other sort of zoonotic diseases that we are not even aware of. In terms of that, yes, there are lots of challenges because number one, there are so many entry points into Lagos. So even the main point of entry that we would be looking at as a state government to try to put some sort of enforcement, you obviously see illegal entries into the state, obviously in the dead of the night and what have you. So that is actually very pervasive in the state. And then to be able to even trace the animals back to the point of origin, by the time you get to the animal market in the morning, you can't even tell which animal came from where and from which state and what have you. So even to trace, to tag, it is a Herculean task. Also looking at the number of vet doctors that we have within our veterinary departments. When you now move on to the transportation of these animals, obviously, a lot of these animals are not being conveyed in the right kind of trucks. And by the time these animals get here, they are highly distressed. And most often than not, they are put to slaughter almost immediately. So what you end up getting is sick animals, distressed animals, mostly water weight, are not actually having the beef, which in effect has a ripple impact on the profitability that the sector players should have, and automatically it reinforces the notion that only a certain caliber of people can play within the space, whereas it's a very profitable space. When it comes to the slaughtering as well, like Dr. Junaidu had mentioned, the traditional approach is what is so entrenched in the minds of our people that any attempt to move to mechanized or semi-mechanized form of slaughtering, it is met with heavy resistance. I know how much effort we've put in here as Lagos State government in trying to change the mindset of our people. In past administrations, butchers had actually been taken all the way to Botswana just for them to see the technologies and methodologies around how animals can be slaughtered, that it will even be more profitable for them. But upon return, and even with further sensitization and training, the butchers have just refused to move from that traditional system because they see any new system as more or less a threat on their means of livelihood, and also obviously on the kind of margins that they think they might make if they didn't go the scientific route of weighing and what have you. So there's a lot of gap around skill set, and there's a lot of gap in terms of the education around the business they are into. So they'll still rather go the traditional route. And we've realized that, you know what, you can only push for so long. Right now, the strategy cannot be to push the old horses, trying to force them to drink water. The best thing is just create a new well entirely and get new horses to go there. So what I'm saying is, rather than trying to change an old system that has refused and is set in its ways, the best thing is create an Uber kind of formula. And I always make reference to the Uber and the boats and what have you. This new industry or sector in the transportation business, it didn't come trying to usurp the regular yellow cabs or any other type of cabs in any other part of the world by maybe trying to show that, oh yes, we are competing with you. The people, the consumers actually made the choice themselves. And at the end of the day, any existing taxi driver, yellow cab driver, black cab driver knew what to do to keep their business in place, was either to migrate to an Uber platform or migrate to any other type of platform where in terms of services, they could be checkmated and the people can actually make references. So that's actually the best approach that I've seen that can work within the space. Rather than trying to change mindset for people that are not willing to change, create a different platform entirely. Let the people see the difference in using the traditional slaughter slabs and abattoirs and creating new systems where you're partnering more with private sector players and be able to showcase what those private sector players are doing much more, show the benefits health-wise especially, and let the people decide where they would rather buy their meat from. And slowly but surely, you start to have the traditional butchers migrate to a better and more healthy platform around animal slaughtering. So that's the challenge we've seen and we've faced heftily around the slaughtering side of things. When you move on to the logistics part of it, obviously we run the refrigerated meat vans, which is where the meat vans are supposed to be cooled, and they're supposed to move the animal carcasses from the abattoirs to different markets. What used to exist before was that you have this guys take the carcasses on bikes, on push, now using the eco-refrigerated meat van. We may not be where we want to be yet, but I know that at least in Lagos State, to move meat around legally, that is supposed to be the only way. We're also trying to put capability to be able to buy more meat vans for the proliferation of cold refrigerated trucks to move. Is the marketing of this meat. So butchers market, but exactly how is meat being sold in Nigeria around red meat? It may still not be world class, but it is definitely far better than what we have obtainable in Nigeria. They sell meat per kilo or per pound. So on average, you are sure of what you are buying from any part of the country, but the same does not exist in Nigeria. Talk less of any market that you get into where you have to touch the meat, all sorts of flies and all sorts of, varying degrees of heat and what have you would apply on that meat. And before you know it, you're not even sure of the condition of the meat you are purchasing to cook in your house. So the idea is the state of our market, it is very poor. The state of our market is not what it should be. And therefore, the idea would be, how do we develop last mile meat shops? And what I mean by meat shops is in any country where you're trying to standardize, you first of all, as a government agency, push a pilot program just to showcase to people that there's a better way around which they can buy their meat that is even more dignified than them walking into an open market and touching the meat here and there. So for that reason, we as a government, we are investing in developing the last mile meat markets, which is where you have an average 20-foot container, which is now being looked at and which is actually being modernized into an appropriate meat shop where you have your open meat display units covered and what have you, using the Teflon tables where you have your butchers also wearing their proper garb and what have you, actually be sold under more hygienic conditions where you also have running water. And from time to time, we have officers from the vet department move around this market or move around this last mile meat shops to also monitor and see how these butchers are utilizing this last mile meat stores. And at the same time, continue further training. What we've also tried to embark upon with the private sector players is the Butchers Academy. So like I said, it's one thing to have a sector where you have traditional methods entrenched so deeply from generation to generation. But what are we doing as a government? What are we doing as a body in even trying to reorientate the people, and especially the younger ones coming into the space? What are we doing to show them that there's a different pathway they can take, that they cannot push their fathers and their grandfathers into seeing the benefits in it for them? Which is why we are embarking on the Butchers Academy, which is supposed to be a training program for, I think, about 1 month, to train butchers in new technologies, and not technologies that are so far off from what they do, but just showing them incremental benefits as to how little changes can actually impact on the overall business. And that way, slowly but surely, you begin to see more changes within the space. So the biggest obstacle in re-energizing the entire red meat space in Nigeria is centered more around training of the butchers, reorientating them before even bringing any appropriate technology into the space. So that's actually what we are working on and trying to do here. But on the other side, like I said, the aggression from our end is to push more private sector players into the space, whilst we deal with the traditional system in trying to get them to also change. So we're establishing feedlots on 750 hectares of land in Ekpe. We already have private sector players who have already showed interest, and we should start actually the rollout of this feedlot program by the end of this month. The last mile meat shop, like I said, we are all
So I think the Honourable Commissioner is having some technical issues, so we'll just give her a few seconds to come back on.
Yes, so I don't know if I was lost for long, but like I said, we also work annually on our monitoring, enforcement, and compliance activity. Yearly, we've actually just kicked off again about a month ago, where we have a task force team that moves around the states trying to shut down illegal slaughter slabs, illegal abattoirs, stray animals, and not particularly restricted to cattle, sheep, and goat alone, but even dogs, cats, strays, and what have you. So the vet team anchors this every year, and they actually try to make sure that at least in terms of regulation, they enforce that. But what we decided for this year was, rather than just shutting down abattoirs, illegal slaughter slabs rather, and just seizing animals, the best thing is sensitize people and show them why what they're doing is wrong, and let them see the benefit in it to do the right thing by using approved abattoirs for slaughter. And if they choose not to abide by what we have said, then you have every right to actually do the needful around the enforcement. So we actually just embarked on that as well. And then there are so many other programs in the works, but I think more importantly, the Butchers Academy, the feedlot, the enforcement, monitoring and compliance, the last mile meat shops, the traceability systems we are working with another private sector player. These are some of the things that right now we are working on to try to just at least shift the mindset of the people within the space, and at least to be able to push health and safety and hygiene around the red meat value chain before negotiations. So I hope I've not taken too much of your time. I hope I've stuck to the 15 minutes that I have. And on that basis, I say thank you.
Thank you so much, Honourable Commissioner Ma. You went beyond 15 minutes, but I don't think I noticed because the story was so interesting. Your efforts are applaudable. Thank you so much. Lagos State is doing very well, and we hope other states can copy from the good work. So Dr. Femi Kayode, you can take over from here, usher in Dr. Jolaosho to give us, present his case, and we can carry on from there.
All right, thank you so much. And then to Honorable Commissioner, there's a lot of questions for you. We're going to have a whole 30 minutes discussion, and we'll be throwing up questions to why Lagos is different. Of course, Professor Junaidu, Dr. Jolaosho, and you will be on the hot seat answering all our questions. But so far, so good. You seem confident. I'm also in Lagos, and I can also acclaim to what you're doing, the good job you're doing. Right, to usher in the discussion, we want to take Dr. Jolaosho for another 10 minutes. But if you have questions, it's been our style in Farmalert for TECLA specifically to make the sessions very interactive. There are a few questions I've jotted down, and you should also state your questions, jot them down, put them on the chat, so that when the time comes, we can take the questions one after the other. My goal, our goal as a team for this session is to ensure that we protect the public. We have the responsibility to do that, and we should do that as professionals. So for the next 10 minutes, Dr. Jolaosho, you want to share with us what your experiences has been, both in the United Kingdom and of course in your sojourning, and the numerous contracts or projects that you've handled across Nigeria going around our abattoir. Where are the problems, where are the challenges, and what we can do going forward? Dr. Jolaosho, a respected elder of the profession and of course an experienced meat inspector. Please, can you just take up the stage for another 10 minutes? Then we'll go into the discussion proper. Go ahead, Dr. Jolaosho.
Yeah, well, thank you for having me. If my case, what do we call it? What am I doing? I'm doing a case analysis, did you say?
Exactly.
Yes, if I have to give you the topic, I would say, I'll call it the reasons why modern abattoirs have failed in Nigeria. As DFID consultant on the meat value chain in Nigeria for about 5 years, I had the opportunity to go around and look at the modern abattoirs in this country and the reasons why they have failed, because they have all failed. And it was World Bank funded. The issue with them was that modern abattoirs have failed in Nigeria, and yet people are still applying for loan and grants to build modern abattoirs. So why have they failed? Sokoto Modern Abattoir, built in 2010, handled by a company called Gidan Haki Limited. Akinyele Modern Abattoir in Ibadan, 2008. Chalawa by Audu Bako in 1975. The Halal Abattoir in Jikoi. There's another one in Kefi built by Nasarawa State Government and concessions to the present chairman of APC. The Bauchi Meat Company, built in 1964, which was a dream by Sir Ahmadu Bello. The Mina Modern Abattoir, the Okoba, Jakondi, 1992, as the Honourable Commissioner said, they have all not been able to meet the initial capacity. Before going further, I want to show appreciation for what Lagos State has been doing as enumerated by the Honourable Commissioner. I'm sure if we give her another 1 hour or more, she will go on and on about what they have achieved in Lagos, which are massive. I remember that Lagos State set up something called Quick Fix a few years ago, where a modern wing was created at Okuoba, which in my opinion is one of the biggest abattoirs in Africa, doing a reasonable number of cattle a day. I also know that Lagos State have developed a side-by-side, just like the commission said, using Yuba, for example, which is a company that is doing slaughtering in Okuoba, which are getting contract slaughtering and are doing very well in a modern way. There's also the situation that some butchers have been sent abroad to, I think it was Botswana, like that. On a score sheet, the modern abattoirs in Nigeria have failed so seriously. Despite the advantages of the meat value chain and slaughtering in Nigeria, we must remember that meat importation is banned in Nigeria, which means production of meat is a business that has no competitors, which in essence means anything that is slaughtered for meat, we sell. No competition from, if you see any foreign meat anywhere, it must have been smuggled. Another good advantage for the value chain is that Nigerian meat, despite the fact that we're not supposed to take meat in, is exportable, especially to MENA countries. I think MENA is Middle East and North African countries, ECOWAS countries, and the countries known as D8. D8 countries are 8 countries that have come together for business cooperation. Nigeria is the only Black nation in it. The others are Arab. They especially would love to have Nigerian sheep and goat meat if we can meet the halal principle, because they know that our meat is organic, no growth promoters and stuff like that. But despite these advantages, there's some disadvantages that are very fundamental. One of them is that for every meat that you eat, whatever you buy it, 40% of middlemen do not have add any value to the chain. That is one. Another problem with Nigerian meat is the public health issue. ILRI, ILRA, have done a lot of research among other private researchers and so on to indicate that Nigerian meat is very, very, there are so many diseases that come from it, zoonosis, if you like, streptotrichosis, staphylococci, E. coli, bacillosis, and all that. So Nigerian meat, because of the horrible way we slaughter here, a means of public health hazard. that is recommended that the consumption per capita of meat should be about 2 kg. It should be about 6 kg. Nigeria, it is about 2 kg, which means that people are not even consuming enough meat. Brazil, for instance, has about the same, have even up to about 30 to 40 kg consumption per capita. So we're not even consuming enough. Now, I'd just like to now go back. It's always a factor that, yes, modern abattoir is needed to arrest the very, very unhygienic that we slaughter meat in Nigeria. Have gone into building modern abattoirs. I've already mentioned some of them. Chalawa in those days, during Abdubako's government, they were importing frozen meat from Argentina. Whenever the plane lands in Kano, people will flock around it. They will buy it. It was frozen meat and so on. And Abdubako thought, okay, why not? Why don't we build one here? And that was how Chalawa was built in 1975. By the government of Abdubako. But today, if you go to Chalawa, despite massive investment, like Professor Junaidu said, everything is rotting away, everything is dilapidated and so on. So why have they failed? If I can show my screen, I just want to show a few reasons why some of these modern abattoirs have failed. Hello? Hello?
You can go ahead.
You can go ahead. We're with you, sir. We can hear you. Yes, sir.
Okay. Reasons why, sorry, I'm trying to see what I need to do to get my screen to share. But in the absence of that, maybe I'll just go ahead to give the reasons why modern abattoirs, it is important to note that an abattoir in Europe, for instance, that slaughters about 150 cattle a day. Probably will be less than 20 people working in it. But here in Nigeria,
looks like there's still a little challenge with his network.
Yes, sir. So maybe we'll just give him some few seconds to see if he bumps back.
If you go to Karu Abattoir, for instance, of slaughtering, you would feed themselves from although they after working on one, you could spill over to the other.
Right, so we're still having that specific challenge, but I really want him to land on his thought before we go into the discussion. So we are talking about the meat hygiene industry. While he's still trying to fix his network, I want to quickly acknowledge a few set of people that are on this meeting. If after doing that, we still don't have him, then we'll just go straight into the question and answer and discussion, where everybody has a chance to participate and air his or our own choice, opinion. First of all, I want to acknowledge Professor Caleb Kudi. Thank you so much for being part of this meeting. The former Executive Director, Nigeria National Research Veterinary Institute, Dr. Shamaki, thank you so much for being on this call. We have a director, a retired director, and of course, one of the consultants now in World Bank. Well, am I correct? World Bank, Dr. Dushima Kwangi. We have an elected member of the Veterinary Council, a very senior stakeholder in the industry, Dr. Gani Nahoro, one time the Chancellor for Africa World Veterinary Association. We have the immediate past president of the Nigerian Veterinary Medical Association, Dr. Ibrahim Adoshew. Thank you so much for being on this call. And of course, I have to mention his name, the Director of Veterinary Service, Lagos State. Your commissioner is on board. And then thank you so much for joining. Dr. Jolaosho, you were off a little while because of your network.
Can you see my screen now? Can you see my screen?
Not yet, but we can hear you clearly.
Okay. Reasons why modern abattoirs have failed in Nigeria, and that was what I'm talking about. I think you should see my screen now. Sorry, just a minute. Okay, can you see my screen now?
Not yet, sir.
Hello?
Not yet, sir. We can hear you, but I presume if we can't see it, you could just go ahead with your
Let
talk.
me just quickly give the reason. Yes. I think I have sent the same slides to you. I don't know if you can beam it from your end. The one that says modern
yes, of course.
abattoirs in Nigeria.
I can do that now, sir.
Okay, please, if you do that. Thank you. Okay. You are not on the first slide, please. The first slide. If you can get them on, I will just run through them for 2 minutes. Yes. Okay, second slide then, yeah? Okay, let me just go on. The reasons why modern abattoirs fail in Nigeria, one main reason is the lack of inadequate feasibility consideration and planning before these abattoirs get constructed. No feasibility study, no business plan. There are no records in most cases. Okay, I like the kind of modern abattoir I've seen in Dubai or England, and I want to, and then you just go into it without doing a proper business study of the situation. Second thing is cultural and traditional practices. The Nigerian butchers do not want modernization. They are very organized under a Serkin power nationwide, who stands as the final arbiter of all sectors involved in animal slaughtering. Butchers relate with hierarchy and great seniority. They live within a traditional spiritual realm, and the leaders are always groomed from when they are born. Somebody who becomes Serkin power knows that he is going to be Serkin power as soon as born and is handled as a prince. And there's usually communalism from generation to generation with traditional practices and rights, which are inherent. The Serkin power and Serkin Shanu, standing for head of butchers and head of people who handle cattle, especially in marketing, are usually part of the Emirate system and meat selling and is the only business that is allowed in the Emirates, in the northern part of this country. And they exist, there exist lots of cultural synchrony that makes their union very, very strong. For instance, in the northern part of the country, we have what we call Hawan Kahu, which is like the cowboy rodeo and matador. This is usually done by butchers, it's a tradition. And then there's also what you call the Gangi music, which is a music that's peculiar to butchers, especially in the northern part of the country. You know, there's also what you call Tatan, which is a name given to the situation where butchers combine to buy a cow on credit. And as soon as they slaughter and they sell, they share the money. In the southern part of the country, there's what we call Ijanja, which is very, very the case in Lagos, for instance. Ijanja is a situation where they buy and then they share parts individually to determine, you know, and then when you sell, you give the money out, and that is how they live. All these things cannot happen in a modern abattoir, you know. So that is one problem we have. Another thing is, well,
let me quickly cut you short. I'm afraid if we continue like this, we will take beyond the 10 minutes. So you might want to just quickly summarize, and then we can pick up some of those other thoughts in the question and answer.
Okay, let me summarize in 1 minute, Femi.
Yes, sir.
Other things are strong local network of stakeholders, not just the butchers alone. They have network where, you know, they control anything that has to do with animal slaughtering. And then usually there is no, in the modern abattoirs, no consideration for what people will do when you throw them out of job. Like the Honourable Commissioner was saying, it's better to leave them there and do something modern as alternative. Installation of some of them, the modern abattoirs had, you know, equipment installed that are not locally conducive for use, and so on. You have this presentation on slide there. People could look at it. But the final thing is, it now brings a challenge on what we need to do to allow the advent of modern abattoirs in Nigeria. And I think the Honorable Commissioner of Lagos and what Lagos is doing are fantastic for the right direction.
Thank you so very much, Dr. Jolaosho, for that brief intro on why the modern abattoir has failed. So right now we will go into the interactive session.
Please, Femi. Please.
Yes, sir.
Please, Femi. Name is Jolaosho, not Jolaosho.
Jolaosho. Jolaosho. Thank you so much. But I think I can just restrict myself to the first name, Dr. Ade. Thank you so much. We appreciate your time. So I think it's now time to interact. We have 3 hub experts, Professor Junaidu Kabir, who was my lecturer in school, A.B.U. And then, of course, we have Dr. Ade, who has experience both locally and internationally on the issue at hand. And we have a policy maker, in the person of the Honorable Commissioner for Agriculture, Lagos State, one of those states that is blazing the trail. I think Professor Junaidu Kabir, can you hear us? Are you on now? Is your network fine? Professor Junaidu Kabir?
Yes, I'm with you.
Fantastic.
I'm with you.
All right, so I'm going to throw a question. I'm going to start with a question, and I will start reading out questions, and I'll throw it all to the 3 hub experts we have. You know, in this part of the world, if someone dies, they would say, God brought it. I do, but I also know that there are man-made issues around our activities that causes us to lose our loved ones. We have several meat-borne zoonotic diseases: anthrax, tuberculosis, brucellosis, salmonellosis, right? These are all diseases we know that move from animals to human beings, specifically that can be controlled at our abattoir. The Honorable Commissioner has raised the question of traceability. That's going to be my second question, right? From your experience and expertise, and this is going to be for the three hub experts that we have, why is it that difficult to ensure that every slaughter slab or every abattoir that we have in the country is manned by professionals who are who understand that their duty is to the public and not to their stomach, who understands that them being there, right, is to protect 200 million Nigerians who are not opportune or who are doing something else, right, to ensure that the entire society move forward? Why is it difficult to have the very basic standards upheld in our slaughter slabs and in our abattoir? You have a minute to 2 minutes to have to just go straight to the point and help us handle that question. Yes, Prof.
Okay, thank you very much. I'm sorry I couldn't finish my slides. That would have answered part of these questions. But you see, I keep saying this. If for one day, people in Nigeria said, we don't want these abattoirs, will not eat the meat, just for one day, we're going to see changes. One of the biggest problems is that our level of sensitivity to some of these foodborne hazards is extremely low in Nigeria. And like I said earlier, it may be because we don't have enough meat available. But if only people understand what is involved, because now our abattoirs have gone beyond transmission of zoonosis. Because a lot of times people are comfortable with the fact that if they cook their food very well, they will kill microorganisms. But one of the things that we need to highlight enormously is that the dangers in our abattoirs is not only about infectious agents. What is going on in our abattoirs now is also promoting, if you do a thorough investigation, is one of the major sources of cancers in Nigeria. I have some slides. I don't know whether you allow me to share them, which I just took this week.
Go ahead, you can quickly share.
Okay. Can you see now? Can you see my slides?
Yes, we can see your slide, Prof.
Yes, we can, sir.
You see, I just want you to look at this picture. This is one of the very serious delicacies in Nigeria now. And by the side, you see there is a big tire there. Many of our abattoirs are like this. They look more like factories where they're doing some combustion rather than a food processing place. People are massively using tires to smoke what human beings are going to consume. And the dangers of this, of course, is that these things, because of energy issue, because of lack of firewood, and because nobody has intervened, is really a very, very serious problem. Because in many parts of the country, the meat is skin on. The skin is still on the meat. They only burn off the hair. And the primary source of oil now is tires. And these tires, products of combustion of tires, produce two very dangerous carcinogenic compounds, dioxins and furans. And this is well documented. So you see, because the abattoirs have collapsed, they have become like failed states. Now they are having terrorists. And these are the kind of things that are equivalent to terrorists. Now, new threats that are more serious than the initial ones. Because if these compounds are in the meat, there is nothing you will do to get rid of them, not even washing. If you cook, you further activate the compounds. In addition, these abattoirs are now constituting enormous threat to the environment, whether they are poultry, whether they are, look at the waste, and the way these waste eventually end up in the environment. Abattoir environments are an enormous threat now. The story I was telling you is about a DVS that didn't want us to go by the abattoirs. We have foreign guests, so he took the way around. And I was asking him, why did we take the long way? He said he didn't want to carry the guests by the abattoir because of the smell. People that live in near abattoirs are suffering. If you are driving past an abattoir, you quickly raise up your glass. So it's not only about the zoonotic disease, it's about the collective public health nuisance abattoirs constitute. And so we have not succeeded in terms of pushing the infectious disease part because people cook the meat. They think they are safe. But we have to now argue from other perspectives about the long-term dangers of what is going on in the abattoir. And I think this is perhaps one of the new discussions that we need to be having in this country, so that authorities know that the dangers are multiple, not limited. And it is only when we have this understanding that people can begin to say, okay, this kind of food, meat, I want to stay away from it. And once we get sufficient public health concern, I tell you that it's not about importing or setting up new systems. The old system will begin to change because majority of people in this country are poor. Majority. So even if you set up new production system, yes, it will work in Lagos, I agree, because public health interventions work in Lagos. Whether it's abattoir or it's COVID, Lagos will do excellent. And why? It's because of public, the level of sensitivity of the community, of the citizenry. It's not the same in other parts of the country. And so that is why what we are doing wrongly in other parts of the country, like the commissioner rightly said, about the quality of the animals that are supplied to Lagos will impact on food safety, even if Lagos is doing the correct thing. So this is a whole package, and it has to do with the way the animal health system is structured in Nigeria and some of the necessary resources that we need to bring into the sector. And that is the issue. If this system requires financial intervention, I tell you, no state government, no local government can solve this problem. We have to declare a federal emergency on abattoirs. When I say federal emergency on food safety. And in this country, emergencies have been declared and resources pumped. There was an emergency on fertilizer. And we've seen other public health emergencies where federal government came in, took World Bank loan. Why not for abattoirs? Why not for meat? Why not for food safety? I hope I have made
Yes, Prof. I will still come back to you, but you could please do stop sharing your screen. But there's something very important I will want you to discuss, especially that we have a community of veterinarians, most of us that you have taught. But what was a scary thing in your discussion was the permit me to use the word pomo, that we all consume. And to the Honourable Commissioner, I know your Director of Veterinary Service is also on this call. Do we still burn the skin of our cattle with tires in Lagos? If yes,
okay.
How can you help us solve?
So yes, so do we still burn the skin of our tires? So our part of our sensitization program is for areas where it's still being done, for them to desist from it, which is why our monitoring, enforcement and compliance units, the task force team, that is part of what they do. So any of our state-owned slabs or those we have collaborated with private sector players, they actually don't use tires. They don't use any of such crude methods around the burning of skin. So they actually use gas. And for that reason, we actually do not. Now, do we have illegal slaughter slabs? Yes, we do. And that obviously is as a result of the massive influx of people from all over the country and in pockets that maybe we don't have the capacity to reach as a result of the number of people we have within that space. So yes, illegal slaughter slabs will, but for those that we are able to fully and adequately control and monitor, they actually do not do that.
All right, so as a
and then back to the question.
Go ahead.
Yeah. Go ahead. Yeah, so then back to the question around why we don't have competent private sector players, possibly within the space, manning our abattoirs and what have you. The truth of the matter is that for most of these abattoirs, if you look at the timelines in which they were actually established, they were way before many of us even came on board into government as policy makers or policy enforcers. So a lot of political dynamics is within that mix. And obviously, as historically told, or as history would have us, pan it out, that when it comes to the red meat, it is dominated by a particular tribe in Nigeria. And for that reason, any attempts to even try to shake things up or to ruffle feathers, you would obviously have a lot of political backlash before you can even implement anything. So yes, it's actually very difficult to implement and bring changes within the system, which is why our own advocacy is more now around, let us establish new facilities, and these facilities, obviously private sector completely, and not even just ordinary private sector participation in terms of screening, in terms of selection, in terms of even giving approvals. We know that there's a track record. We know that, okay, in terms of the capacity and the capability around running such facilities, systems, and what have you. So I believe with time, we'll get there. We're just trying to migrate from a very traditional system to trying to even utilize technologies now. So it will definitely take us some time. We might be too slow in doing a lot of things and in pushing, but we'll surely get there. We won't get there in one day. We won't get there in 1 year.
Right.
Yes, so I've answered the question.
Okay, thank you so much, Honorable Commissioner. I'm still coming back to you on some policy issues, but let me quickly take Dr. Ade. You've been around the country for a while, checking all our abattoirs and all our slaughter slab. I want to ask you directly, which are you most impressed by and why? So again, while he's coming up, I want us to keep our questions coming. I have the luxury of taking 5 questions, select 5 questions from the chat. So we would do this in 10 minutes, but I want to get Dr. Ade to make comments around, in his going around all our abattoirs and our slaughter slab, which is he mostly impressed by and why? Because the more we start showing these models and why they are succeeding, I think the better we can tackle these entire issues. Dr. Ade. All right, if he's having challenges with coming back, let me get back to Professor Junaidu Kabir quickly. Now, you're talking to mostly vets. I think we have over 200 participants coming in, going out, coming in, going out. Right now, we have almost 160 vets listening to you. Most of us are in private practice, some are in government-owned facilities. And I think majority of us, while we were serving, we were pushed to slaughter slabs. What do you think is the biggest change veterinarians need to make nationally to, if not totally eradicate some of these menace? Because in my own, what we were taught, what you taught us, is that every meat that comes to the slaughter slab should be inspected by a veterinary professional, if I'm correct. Where's the missing link? Are we inspecting all? Or what can veterinarians listening to you now, this is going to be part 2, where we were taught in the class, now we're going to be taught virtually. What do you think we can do now to improve the situations, if you had to give us some advice as veterinarians?
I think we cannot pretend that these issues are easy. There are the interventions that are required at multiple levels, if we talk about the veterinary profession. Because abattoirs are not only, they are primarily for slaughtering animals, but they are also surveillance points for disease control. They are also for economic purposes. processing of animal products. And so they are raw materials for other industry. So we have to bring in these other stakeholders into not only in the discussion, but into the intervention. That why interventions in the abattoirs will overall not only promote meat, good quality meat, but how it will also impact on other aspects of the economy. Now, for individual veterinarians, there are those that are posted to work at the abattoirs. And I know many people don't find it pleasant. And many people are frustrated about the inability to enforce some of these things or the lack of facilities to work. I think we shouldn't give up. People should remain committed to doing the little, whatever they can do to improve the situation. And we must sustain, engage with the stakeholders, particularly the people that are involved, workers in the abattoir, to continue to enlighten them. Because really they are ignorant. Many of them are ignorant. And there have been some few models that have been tried where these people were engaged, and there were some few changes, at least in the level of hygiene, at least in the way they handle the product. The problem is when we start, we don't sustain. These things have to be sustained over time to make impact, for us to have results. Because like one of the presenters said, when people grow up with a certain attitude, it takes time for you to change that attitude and to show them new ways of doing things. I don't give up on the butchers that they cannot learn new ways of doing things. Now, like I said, one of the things that even causes war is touch people's integrity, people's decency and integrity, and also touch their means of livelihood. So any intervention that will enormously impact negatively on the means of livelihood of people will not likely succeed. But changing methods can also create ways in which we change livelihood issues. For example, now the climate change argument, when people have said, okay, don't use fossil fuel, use alternative energy. Some people don't like it. It impacts on their livelihood. It impacts on their source of income. But if you show them the alternative and the economic benefit of the alternative, and you actually make them actually benefit, but if you bring someone else to benefit, they'll continue to resist. And unfortunately, majority of the population depend on this system we are complaining about. So as veterinarians, we cannot give up on public health education. We've had some trainings for butchers, and we've seen some impact. We've seen some difference. So I want to ask this question. How many state veterinary services organize on an annual basis training for butchers? Exactly. Or public health education for butchers? Sure. We don't have it. Maybe MVMA in the local MVMA chapter will once in a while organize for discussion or some training for butchers, but it's not sustained. It is not a national program. That's why we don't have a national plan to solve this problem. And we have a national plan. We can scale it down, what states will do, what local governments will do, what the veterinary services is expected to do, what private vets, what other private or public stakeholders are expected to do. And unless we have that plan, unless we declare that emergency and we want to solve it at a national level, we continue to have this discussion.
All right, thank you so much, Professor Junaidu. I want to get back to the Honourable Commissioner, and I'm still glad that the President of the Council is still around, because I'm going to also pull our attention in something. Somebody asked a question, Honourable Commissioner, I'm going to be reading that out. He was asking, should butchers be allowed to drive the quality of meat at the abattoir, right? Some of these butchers association, they are more like the god of the abattoir. In your experience, in your trying to ensure reforms, well, first of all, maybe we should ask you, do you have challenges with these butchers? And then, is it possible to get professionals to drive things in the abattoir? How easy will it be from a policy standpoint?
So do we have do we have resistance from butchers? Yeah. Very much so. A lot of the transformation we have tried to implement, particularly in the flagship abattoir for the state, with a lot of support from the private sector players manning the space. You see at the end of the day, and even with the butchers being carried along from the point of inception of such transformation programs up to the actual implementation, they end up being the one to resist. And the resistance is usually not even full frontal resistance. It's more or less passive aggressive resistance, meaning you put everything in place, private participants spend monies, and at the end of the point of, okay, let us now implement this fully. So case in point, last year, we had demanded that slaughtering on the slab should cease. Now, regardless of the fact that we slaughter almost 1,000 heads of cattle every day on the slab, we knew that our mechanized and semi-mechanized lines within the abattoir at Okoba alone would not be able to take that much traffic in a day. So we had decided that, okay, even if we could do about 20 or 30% of our slaughtering along the mechanized and semi-mechanized lines, we will slowly but surely upgrade in terms of numbers and be able to do much more. And the private players manning the mechanized and semi-mechanized abattoirs spent monies. And this time around, we didn't even try to proffer solutions to say they needed to use the fully mechanized lines. We tried to find a compromise because they complained about a lot of issues around the mechanized lines and how it wasn't profitable for them, how it wasn't functional enough for their own use and what have you. So we decided to reach a compromise, and they were part of the architecture of doing this change, of implementing this change. So we decided to go by a platform system. So instead of slaughtering on the floor, you slaughter on a platform. And then in terms of everything else that is required around cleaning of the carcass and what have you, everything was put in place. And then the point of implementation came, and these guys chose not to patronize these private sector players within the same abattoir. And we tried so many things, but these guys came up with all sorts of excuses, even though they had suggested these compromises in the first instance, even to the point where, as the state government, we took it on ourselves to buy cows and just to use as exemplars for them to see, like, okay, how many minutes will it take for us to be able to slaughter a cow on a mechanized line? How long will it take to slaughter a cow on a platform, so that we could try to at least imitate to a reasonable degree the timing it took for them to slaughter on the slab, because they felt slaughtering on the slab was faster, it was easier, and what have you. So we did this a couple of times just to show that you can actually have it even done on a mechanized line, on a semi-mechanized line within the same time frame, and it will be cleaner and better. But these guys just refuse to utilize this line. And at the end of the day, you realize that whatever activities, whatever initiatives you bring to the fore, and you even call them, and they would agree with you, they will tell you, oh, it's fantastic. But at the point where it should be implemented, you will not see these guys supporting. So it just goes to show that the mindset is just not the right one. So rather than just consistently and continuously wasting your time, it's best you start to push more private sector players that want to bring the change, start utilizing them more, and slowly but surely sensitize the public, show them the old system, show them the new system, and let the public make that decision that at the end of the day, the traditional butchers don't have a choice, which is why I'll always still make reference to Uber and the Bolts of this world. They didn't come trying to change the space and, fighting this establishment. They just brought a solution that people decided they would rather go for. And that is why Uber is faceless, Bolt is faceless. There's nobody you want to fight. You understand? And a lot of these guys, yellow cabs, black cabs, they migrated from their existing platforms to this platform. That's the same thing we'll need to find a way of doing around the red meat value chain. It won't be easy, but surely we should be able to do it.
I agree with you 100%, Honorable Commissioner. Somebody says, instead of fighting the old, you create the new. And the part that you mentioned around sensitization, because the public too are concerned about their health.
Exactly. And so, I think the public too, they are shielded too much from what really exists in the abattoirs.
You're right.
And if we were to put it out there more in the public, though the backlash now comes on the back of the government, which is the reason why I think a lot of government establishments try not to showcase it, because in as much as you showcase it, the implications is far more reaching than just you showcasing something and saying you're trying to change the people within that space. Like I said, the ripple effect of it goes beyond you just trying to establish that change. And I can put it and mention it here on this platform. Like you said, my director of vets is here. We know the kind of changes we've tried to implement. And before you know it, you are getting calls from somebody saying that they are calling from the Sultan of Sokoto. They are calling from the Emir of Katsil. You would start getting calls from the high and mighty in society that you are trying to interfere in the activities of the abattoir in Lagos State, Agege. So you are not just trying to change a facility that you think there is nothing. No, this goes beyond just the people there. It has far-reaching consequences that at the end of the day, you realize that, okay, how much enforcement, how much change can you really bring into something that has been so systematically and systemically warped, politically, ethnically, tribally, religiously. These are 4 angles we are dealing with, and it's not just enough to go there and say, oh, I'm a vet doctor, I want to bring this change. A lot of the times, my vet department, they feel incapacitated. You want to make changes, but you know that any attempt to even try to do something along the line is going to squeeze you up. You know, it's just along those lines. So it goes beyond just health.
You know, Honourable Commissioner,
create a new system and let the people choose, let the people decide what they want.
I salute your courage. A few years ago, I attempted opening a private slaughter slab, and I was finding it difficult to get some cattle, and somebody advised I should go inside the bush and source some. A friend of mine called me and advised me that one day I will go inside that bush, I will not come back again. That was how I stopped Meat Master. It was Meat Master then. I salute the courage of people like you who want to really create change, looking at the level of resistance you face. I want to draw the president of the council's attention. I don't know if she can quickly unmute herself. I think one of the things we can do right now is sensitization. And as the Honourable Commissioner has advised, bring up people with the different thoughts and put it side by side with the old system. If the president of the council, AIG, are you still with us? I can see you on the call, but I want to be sure that she's comfortable to talk. If not, I will just direct the question to Professor Junaidu. Is Dr. Ade back up? Technical people, is Dr. Ade back up? Okay, he's not back. All right, Prof, I will have directed it to the president of the council. I don't know if the, okay, so let's take, Dr. Ado, are you here? Because we need to, let me try and get you to, just a moment. Technical people, I need to get Dr. Ado to unmute himself. All right, Dr. Ado, you were one-time national president of the Nigerian Veterinary Medical Association. Dr. Ado, if you're around, the Honourable Commissioner has stated the reason why sensitization is a powerful force. The public, she mentioned that the public is shielded, right? The public really don't know what's happening. Professor Junaidu is showing us the implication of having our pomo, well-loved pomo roasted with tires, the cancer implication on the public health. What do you think, as a past leader of NVMA, could be done to get veterinarians to talk out some more? If we have 1,000 people talking out, 2,000 people talking out, sensitizing the public, we have the association sensitizing the butchers, have the council encouraging vets to sensitize the public. I think we can slowly and gradually create change. Please go ahead, quickly.
Thank you very much, Dr. Femi, for the opportunity to speak, even though I was not I have not prepared anything. But Professor Junaidu is my mentor. He has been my mentor right from day one in the vet school, and we have done some very good works with him, both in my undergraduate and postgraduate. As he rightly said, to change the attitude of the butchers is not a one-day affair. We all went to school and we all learned how to do things right. But especially in the abattoir system, once you go out there, it's an entirely different ballgame. The butchers, the local butchers run the show. As you just mentioned in your experience, if you try to bring anything modern abattoir or such to the butchers, they will blacklist you, let me put it that way. You won't even get the customers. I don't know how they do it, but nobody will patronize your modern fancy abattoir with all the neat meat, and the general public also has their problem, because I could remember, I think when I was doing my NYC, I condemned meat from a cow. The whole viscera was filled with tuberculous nodules. You can see it as clear as daylight. There was tuberculosis. But before you know it, they started wielding weapons outside. It's an abattoir, there are sharp knives all around. So I had to take a step back and go out of the place, because before you know it, someone would injure you trying to just simply tell them that this meat is not fit for human consumption. So the sensitization is not going to be a day affair. We have to constantly do it, like on an everyday basis, for as long as it takes, so that we can be able to change the mindset and the perspective of these people to gradually start accepting the new and better ways of doing things. Because as it is, honestly, we are losing the battle on this abattoir issue, and it's as clear as daylight.
Thank you so much, Dr. Ado. Let me just take the final two people raising their hands, and then I'll ask Dr. Professor Junaidu to state his last word. And then, of course, the Honourable Commissioner, whom we've had the pleasure, regardless of our very busy schedule, stay with us veterinarians for 2 hours. So I will take Dr. Zaliani Shehu. Dr. Zaliani Shehu, just 1 minute, straight to the point. Let's have you make your comment. After which I'm going to call Dr. Jeremy Barnabas, and then that will be it. Go ahead, Doc, we can hear you.
Good afternoon, everyone.
Yes,
can you hear me?
Yes, we can hear you, Doc.
I actually joined late, but I'm very glad to have the opportunity to speak. Prof. Junaidu was my lecturer right from, and my supervisor as well. We actually did a lot of work on the abattoir related issue. Fundamentally, I think the issue of sensitization, as it has just been raised by Dr. Ado, is very, very important. And I concur with the Honourable Commissioner with regard to the issue of private sector participation. I think it's very important that the government should at this time kind of take away, give out the responsibility of managing the abattoir to the private sector, because anything that belongs to government, definitely you have a situation where maybe it's not going to be managed very well or the way it's supposed to be managed. And what Dr. Junaidu said as well is whether the Directorate of the Veterinary Services are doing anything. I think we really need to sit up. The environment alone cannot, at this time be able to do all that is needed with regard to the sensitization. So I think I don't have much to say, and I really appreciate the opportunity given to me. Thank you very much once again. I'm glad.
All right, thank you, Dr. Shehu. Please, Dr. Barnabas, can you quickly make your comment before we ask for the final words, and then we summarize? I hand over back the stage to Dr. Tunsia. Dr. Barnabas, if you're not saying anything, okay, Dr. Barnabas, go ahead.
Okay.
Straight to the point.
Yeah, good afternoon. Good afternoon, Doc.
Yes, good afternoon, sir.
Yeah, thank you for this opportunity. I would just like to throw more light and then to also drop a thing of concern. I served in Kabir 2018, and at the Central Abattoir, there's this practice of young bones being inserted into the rumen of a slaughtered animal. And to my greatest surprise, vets were there and they could not see anything about it. Then secondly, there is this project is on, and as Professor Junaidu said, we're not just at the abattoir for just meat inspection. Those are surveillance points and also control points. And sometimes you find it a bit difficult where you have senior vets who, despite they know the ideal thing to be done, they still don't want to encourage some of us that are just presently on the field to see how we can eat surveillance and reportage of some of these diseases. So thank you very much. This is the little I have to say.
Thank you so much, Dr. Barnabas. Let me give two more persons. Dr. Gani is a member of the Veterinary Council, and I think he can talk. He's the chairman of the Continuing Education. And I'm just thinking he's also going to be a very instrumental part in inspiring education for the butchers and the stakeholders in the industry. Dr. Gani Nahoro, please can you just say something? How can we inspire sensitization?
Well, thank you very much, Femi, for this opportunity. I think the issue is far much more than what we think we know. The Lagos state government is doing very well, but it's like putting new wine in an old bottle, and we expect it to work. If we are building such fantastic modern facilities, digitized environment, we can't hand them over to analog management. We have to think of the value chain in the sense that we have to find out who are the off-takers that we should target from these abattoirs that we are modernizing. We can't expect the same kind of people who are off-taking the meat from analog system to also continue to off-take the meat from the digital system. It will not work. So it has to be, before we invest so much money in modern facilities, we also have to look. I know that ShopRite bring in meat from South Africa into this country to sell in their shops. Those are the people, we need to organize them as meat users to be ready to patronize and work with these modern abattoirs before they can work. I have some friends who work in oil companies offshore who are allowed very wrongly to bring in meat that they will consume in months into Nigeria, despite the ban of importation into this country. So a lot of things are actually not doing right. I think the sensitization needs a lot. When you have veterinarians that are so little, so few in number in public service, and you expect them to be used to manage facilities that the public so large will be, you have veterinarians that are not in local governments. You have some states, one veterinary doctor servicing two local governments. What are they going to do in the abattoirs? And the director of veterinary services are not complaining enough to tell the government that the veterinary services are not being rendered. So I think we should begin to allow private certification of private veterinarians to join in allowing this public sector significance to take place. And we all need to be, all hands have to be on the deck. There was a time when I was president of NVMA in Cross River State, some veterinarians were attacked, public servants, veterinarians, by butchers. And when the NVMA executive decided to take it up, we wrote to the state government, and unfortunately, the director of veterinary services and some other senior veterinarians who are in public service discouraged us not to come and cause trouble in their state. So we all need to put our house in order. This is one area of veterinary service provision that can give us a very big publicity in this country, that can allow veterinarians to be able to go on strike, and the whole country will feel it. And we are handling this with kid gloves, all of us. At the level of the council, the president is here. Of course, we need to join Professor Junaidu, who is the member of the council, to declare a public emergency around this. Let the governors, let all those big people know that the meat they are consuming is also coming from this unwholesome source. There has to be a public emergency around it. Then we can begin to take it back home and see how much you can influence the system. Thank you, Femi, for this opportunity.
Thank you so much, Dr. Gani, another statement. Quickly, Dr. Shehu, well, I've gotten special requests to allow you just straight to the point, Dr. Shehu, then Dr. Kwange. Then I go back to Professor Junaidu to give us some final words, and of course the Honourable Commissioner, and I'll hand over to Dr. Tumsia to have a final closing protocol. All right, Dr. Shehu, quickly. Dr. Shehu Shamsuddin.
Okay, yeah, thank you very much, Dr. Femi, and well done to all of the presenters. I think it's been very insightful. What I just quickly want to add is, in addition to what the Honourable Commissioner has said and what Professor Junaidu has said, we need to understand that we're dealing more with a systemic problem, and it requires a systemic approach. What we have been doing in the past is to apply technical approach. Let's fix this, let's train them, let's sensitize, let's enforce. These things seem not to be giving results. So I think it's high time we look at it more systemic. This is a Nigerian problem. This is a leadership problem. And as such, we should approach from the social part, just like she said earlier, from the economic part, from the public health part, and also know that it is not something that veterinarians alone can solve. This requires a lot of mobilization across board, policies, public, and so I think that we can achieve this if we invite other professionals, invite other people, other sector players to look at it as a truly Nigerian problem and not just a veterinary or a public health problem. Thank you very much.
Thank you so much, Dr. Shehu. That's so much of an insight, looking at it from the systemic rather than from just the technical angle. Dr. Doshima Kwange, if you're on, just a minute, and then we will get to Professor Junaidu. Go ahead.
Thank you so very much for the opportunity. I want to congratulate the Honourable Commissioner for what they are doing in Lagos, and I wish all of us a huge success. Two things really for me. One is that the government also needs to intervene in some of these situations. We may not be the best at a point, but we really need to bring up the other slabs. Because if we do this in the, in the capital cities, what happens in the local government areas? So I think that apart from trying to have these good abattoirs at the state capitals, we can also try to upgrade the smaller slabs, provision of water, provision of, rails where they can hang up, meat. So those little things, if we start them, it will count. But I think looking at what Professor Kabir said about use of tires, the government really needs to intervene. Now, if tires are cheap, that's why they use them. They want to maximize their profit. Okay? Now, firewood is quite expensive. We are not supposed to cut down trees, to use for firewood. So that's also a huge issue. Now, the commissioner said that they are trying to use gas. Gas is out of reach of the butchers. So the government needs to intervene in the various ways so that this is also cost effective for those that, sell the meat, so that their meat is not outpriced for the people who want to, patronize them. Thank you.
Thank you so much, Dr. Kwange. Now to Professor Junaidu, your final word, but before your final word, when I had my private slaughter slab, one of the key advice I was giving was that Muslims wouldn't eat my beef if it were not slaughtered in a particular way, right? So I'm true to the word. They were concerned until I had to hire a Muslim slaughter person, right? If we equally sensitize the public and the public understands that what's giving them cancer is coming from the burning of the tires, and that sensitization is strong enough, I think we can force the hands of the butcher to be more innovative. If they know that we will not consume any meat burned by tires, they will find an alternative. Professor Junaidu, you've been our lecturer, and we're glad to have you on board again. If you have a final word for this teaming young and old and mixed veterinarians, what will that be in moving this idea forward? Just to see that we're contributing our quota in Farmalert to ensuring that the public are protected and veterinarians are happy doing what they are doing. Go ahead, a final word from you, Professor Junaidu.
Thank you very much, Femi. But before my final word, first, let me commend Farmalert, because it is important to be having this discussion. So to bring various generations of veterinarians to discuss this is extremely important for us. Secondly, you see, these things are not peculiar to Nigeria. So when we talk about the cultural and the ethnic issues, they are not peculiar to Nigeria. And I tell you, there is no human being that will not jump at economic opportunity. Abattoirs, we have been unable to make the case that abattoirs is not about meat inspection. We've been talking about meat inspection only. We have not been emphasizing the fact that abattoirs are surveillance points, are disease control points, are economic points, are sources of revenue, are sources of raw materials. If we make this economic case, in figures, we are going to start getting additional attention from government. Those of people that know Nigeria in the 70s and even early 80s, meat hygiene and the condition of abattoirs was not this bad. What happened is the general economic decline and lack of investment in public infrastructure. Unfortunately, the abattoirs are among the first structures that suffered in government and are still suffering. So my own suggestion is that we need to make this economic case. Countries have exported beef and have made profit. Argentina, Botswana. So there is money in this. We need to bring this out to people. We need to bring it out to the stakeholders that are not changing. Show them what they would benefit. Not just change it, force them to change their ways. No, show them what they will benefit. I agree completely. We should marry the old and the new together. As we grow the new, we should transform the old. That way we can achieve a more sustainable development. And we can give them on public enlightenment. And that is why I talked about the national plan. And this national plan will contain all the components. How do we deal with the infrastructure? How do we do with the logistics? How do we deal with the public enlightenment? How do we do with the enforcement? I was invited to dinner by a judge who was eating a certain meat, and we got into some of these issues. And when I started telling him about the issues of the abattoir, he stopped eating meat. And the next day, this judge wanted to visit one of the abattoirs. And he did. And he told me what he saw. And he said he's ready to prosecute anybody that is found to have violated the law as it comes to meat safety. So I am telling you, even the educated people are ignorant about what is going on. So we have this obligation to make sure that we enlighten the public, and we continue to champion this cause that abattoirs are as important as any other thing in Nigeria. We must have a plan for salvaging them at the national level. Thank you very much.
Prof. Junaidu, we can't thank you enough. So I agree with your last remark that the judge visited the abattoir and, firm up his ability to want to prosecute anybody who offend in that regard. So I think sensitization is really a very key issue. And if any veterinarian is picking it up, it will be a good thing. Honorable Commissioner, we can't also thank you enough, but I know you have a final word from the policy side, and then of course to us veterinarians. You've dealt with us, you have people in your cabinet that are veterinarians. What advice will you want to have to these teeming veterinarians listening to you? And of course, your final word as we end the meeting. Go ahead, Honorable Commissioner.
Okay, thank you very much. And I think it's been a great presentation and rubbing of minds so far. For me, my final words would be that the changes we want to see, it actually needs to percolate not just within the abattoir slaughter space, but down all the way to the markets. The market being the final destination for the consumer is where changes should also be implemented on such a scale that it percolates back to the point of origin. And what I mean by that is you can do all the needful in the abattoir space. You can get the vet doctors there, you can get the sensitization for butchers and what have you. You can do the needful around pre and post-mortem examinations of the animals, the carcasses and what have you. But if we do not also deal with it from a general food safety angle, and we think that we can isolate only red meat or anything related to meat consumption as a way of dealing with what we are seeing as to the outbreak of zoonotic diseases, then we would not even be doing any justice to this topic at all. So it goes just beyond the vets and the animal abattoir slaughterhouse space. It actually goes back all the way to our market systems, which is why that's the biggest thing Lagos State is advocating for, transforming the market systems. Everything you consume originates and ends in a market for you to buy. So whether be it meat, be it produce, whatever it is, fruits, grains, what have you. What is the system around all of this as a whole in Nigeria? It is almost non-existent. So that is the reason why government, and when I say government, I'm referring to state governments, local governments, the federal government, will not take the vet space or the animal space as a silo in and of itself, outside of the other food brackets. So it needs to be dealt with holistically. So to show someone where the meat is slaughtered is one thing. To show them how their foods are coming in from other parts of the country, being thrown in mud, being thrown in dirt, being washed in gutter water, all of those things. It's a holistic, and it should be a holistic sensitization. That food safety and hygiene as a whole has to be reorganized, has to be transformed in such a way that there's a benefit to every type of food. And that is the way the vet space and the meat space, the livestock space, and slaughtering and processing can also find its feet. If we try to isolate it, the traction will not be there. So to do sensitization of meat alone, without actually showcasing what our markets really look like and why we need to change the way things are being done, is not going to do us much good. Then, the other thing that needs to now be pushed to the forefront, which is a major, major obstacle to why we are where we are today, is our three-tiered system of governance, where you have the federal, the local, and the state government. By constitution, markets are under the local government. But tell me, in your local government, how much of the local government personnel have an active hand in transforming and ensuring that there's a hygienic space or there's a hygienic environment for market men and women to thrive? There's virtually no injection of initiative, there's no injection of creativity, and there's no injection of even hygiene and sanitary conditions, as opposed to the state government handling such a thing in a way where they can drive it in a better way. So even the three-tiered system is affecting how some of these food items are actually being pushed out into the market to consumers, and that is part of the reason why we are where we are. If you go back to an Okoba abattoir, which is a case in point, since that is where we are here in Lagos State, you'll find that the local government has some say in that market space. They are collecting taxes, they are collecting levies and tolls from the butchers, from the market, from the animal merchants, from the truck transporter guys. And you ask, what do they use these monies for? The money is not coming to the state government. The percentage of fees that come to the state government is less than 5% of the entire transaction that happens. In fact, 5% is even too much. I'm happy that I have my colleagues on this presentation. I want to believe it's even less than 1% that the state government gets on an annual basis in the volume of transactions that happens. Even the local government that has no investment within the space is making much more money because by constitution, they are supported. So it just goes to show you that even in the way governance is being administered around how our foods get to us, how we get our foods in the market, and how we buy and sell and transact, there is a problem there. So every other thing we do is fine, but from a policy standpoint, there has to be a reorganization and a shift around how governance is also being structured around our market and food systems.
Honorable Commissioner, so much to chew with your last message. You know, sometimes some last message makes you think much more deeper than you have thought if you didn't hear them. But again, we are so grateful. So while you were rounding up, Dr. Ade came on board. Dr. Tumsia, please permit me to just take 1 minute from Dr. Ade. Please, you went off during the question and answer, and we couldn't hear some of your thoughts. But if you have 1 minute, what will you want to say to us finally, Dr. Ade? If not, Dr. Tumsia, I want to hand over to you to please thank every one of us, especially our hub experts, and of course, the president of the council, and then take us through the closing formality. Dr. Tumsia, over to you.
Okay, thank you so much, Dr. Femi. Thank you to our hub experts, the Commissioner for Agriculture, Lagos State, my revered senior colleagues, Professor Junaidu, Dr. Adi, thank you so much, and every participant in the room for sparing out time. My head is literally on fire because with all of these discussions and all of these recommendations, I just have 1,000,001 things going through my head. And I noticed somebody whose video was on, and when they showed a picture, one of the gruesome pictures, she put her hands on her head, and I was like, oh, okay. I think the Yoruba people will say otiku or something like that. Like, I'm finished. Maybe she just finished eating something relating to what the picture showed. So, and I just hope this discussion at the end of the day elicits actionable efforts by stakeholders, because we just have so much work to do. But I think we keep implementing and coming up with strategies and decisions without putting Nigeria, or should I say, yes, Nigeria, in the middle, because we try to enforce these things on people, but no, we're a different set of people, we're a different breed of people. So we should try to solve our problem in our own context, try to see how we can. So I just hope each and every one of us here is brewing some ideas on how to move this forward. And Lagos State government, you're doing well. Thank you for the effort, keep pushing, and I hope other states will join and copy your model, and hopefully it will be a good story to tell at the end of the day. So thank you everyone for joining once again. Can we have the post quiz? We didn't have the pre-quiz because of some technical issues we faced. So it's just to quickly answer these questions for 3 minutes. We have 5 questions. You just need to answer them, and we can have we can be able to gauge the knowledge gained at the end of this session. Thank you all so much. So please, you can, yes, I can see people answering. It's up on your screen. All you have to do is just click the right answer. Thank you so much. So we're basically going to do this for 3 minutes, and Yes, I can see people answering, but we just have 8% of the participants answer. We can do better. I have about 104 people in the room. So I'll be needing at least 50% participation rate. Thank you so much. And then you can keep dropping your comments and okay, yes. Okay, it's just right on your screen. I can see someone saying he's not seeing the questions, but I'm sure everybody else is. My apologies. So we have 40% participation. We can do better, and we're just about 1 minute and 40 seconds gone. Okay, 45% participation. We can actually do better. We have 1 minute to go, and oh, very insightful. Thank you, Farmalert. Thank you too for joining. Thank you for your contributions. Okay, this is better. We have about 53%. And we have about 30 seconds before we pull down the poll. Okay, so 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And we had about 60% participation. I think we can take down the poll and we can quickly move forward. We can move forward. Thank you all so much. And can I have the next slide, please? And then we can take down the poll questions. Yes, please, you can spare some minutes to some seconds. So what other topics would you want us to address to help us make informed decisions about our topics for next session? Thank you. So you can just drop your suggestions and your topics in the chat box. We have somebody extracting that. And then we have, I'm sure a lot of people, especially veterinarians, have been seeing Farmalert Radio. We launched it in April, and it has been bringing interesting and refreshing content to our community. We need volunteers to create programs, interesting programs to keep everybody engaged. Please do follow us on all our social media platforms, YouTube, LinkedIn, Facebook, Instagram. You just simply search Farmalert and we're there. So at Farmalert, we're enabling easier access to quality animal health care in Africa. Thank you all so much for joining. See you next time. Bye. Thank you, everyone. Thank you, Mrs. Commissioner, the BCN President, Professor Junaidu, Kabir, Dr. Ade, and every other person I failed to mention. You're recognized and appreciated. Thank you very much. Bye. Have a good day.